Hey guys, it's Matthew Zachary, and I want to tell you about the National Comprehensive Cancer Network, or the NCCN. The NCCN creates the treatment guidelines for doctors that help cancer patients lead better lives. But I want you to know that the NCCN also has guidelines for you. The patient guidelines were funded by the NCCN Foundation and were created just for people with cancer and their caregivers. They're free, they're easy to understand, and they're available right now for you, the patient and the caregiver. So go check them out at nccn.org/empower. That's nccn.org/empower.
Hello, Heart of Healthcare listeners. This is your host, Hallie Tecco. If you're enjoying listening to the Heart of Healthcare, can I please ask you to leave us a review on Apple Podcast? This helps us reach more listeners and grow our impact. Okay, now on to today's show. 77% of American households are in debt. And from 2017 to 2021, there were over 3 million personal bankruptcy filings. There's a stigma around debt and bankruptcy, like some moral failing or irresponsibility of the person. But the truth is, for the majority of cases, people are forced to decide between debt and their health. They're paying for their medications or life-saving surgery. Healthcare is just so expensive in this country, Americans can't afford it. Medical bills are the most common reason for bankruptcy. And as the pandemic lingers and a potential recession looms, medical debt remains a barrier for many in securing economic stability and good health, especially for marginalized communities. Medical debt deepens inequity and the healthcare affordability crisis in our country. The stories of people affected by medical debt shine a light on the toxic stress and stigma that comes with medical debt, increasing the urgency for solutions and a shift in the narrative from medical debt from a personal failure to systems failure. Today's guest is the CEO of RIP Medical Debt, a nonprofit that buys medical debt at a steep discount and then wipes it out entirely. Beneficiaries receive a letter in the mail that their debt has been erased. They have no tax consequences or penalties, and just like that, they're free of medical debt. Allison, welcome to the show.
Thank you so much for having me and for that awesome introduction. I really appreciate you.
I do my homework. I enjoy doing my homework.
Really?
And I got really fired up reading about the magnitude of this problem. Maybe you can start by laying the groundwork of the crisis that we're facing with medical debt in the U.S.
Yeah, unfortunately, it hits so many households. 100 million people in the United States have medical debt. It's at least $195 billion problem. And that's just the evidence that we have from credit reports. But we know there's lots of medical debt that doesn't hit credit reports and is hidden because it could be on credit cards. And then that doesn't get captured as medical debt. Or people borrow money from their friends and family, in which case there is no evidence of it. And so the problem is really huge in the United States. And it impacts way too many people and is undermining people's financial well-being as well as their mental health.
Yeah. And you guys have relieved more than $8.5 billion in medical debt, which seems like so much, but there's still so much left to go.
Yeah. I mean, look, what we do is huge. It's really helpful and significant for the individuals who we help. But I want to be super clear with everybody all the time that we are not the solution to the problem. We resolve this for individuals and we're helping as many people as we can. We're grateful for everyone that donated to us to help us solve this problem for those people. But we have got to get it together and do something bigger beyond RIP medical debt at the end of the day to solve this problem.
Yeah. I did see, though, that bankruptcies have been down the last few years. Do you feel like you guys have made a little dent in that decrease?
I mean, it's hard to know and to point a direct arrow to us. What I do hope we're doing is bringing more attention to this issue And so I hope that people are, to your point, not seeing this as a personal failing, that they're understanding the system of healthcare and financing and making better decisions so that they can avoid having to go to the step of bankruptcy. Whether or not that, you can point a direct arrow to our work and the decrease in bankruptcies, I don't know. But at the end of the day, I do think that we're having an impact on the conversation around medical debt and people's understanding of it, which I think is significant.
Yeah, absolutely. And how has that conversation been affected by the pandemic and the number of people struggling with medical debt since the pandemic?
Yeah, well, we know that especially initially, a lot of people lost their jobs as a result of the pandemic. Now, we've seen a lot of recovery since then, but people, as a result, lost their insurance. Also, people weren't going to the doctors, not only because they didn't have insurance, but because they were scared of, getting COVID. And frankly, hospitals and other providers were overrun. So the whole seeking of care was impacted. But at the same time, we also saw a lot more government support of individuals in the form of expansion of Medicaid and relaxing of who could apply and who could get it. And that's all being taken away, actually, right now. There's the end of the pandemic and the official end of the public health emergency is going to impact how many people are on Medicaid, which we anticipate will reduce how many people have insurance and probably go in the wrong direction in terms of people's access to good insurance and therefore the impact on medical debt.
Who is medical debt most impacting? Is it that those that are uninsured or underinsured, a combination?
Yeah, I mean, look, 92% of the population now is insured. I mean, Obamacare, or the ACA as it's also known, definitely helped get people on insurance. The problem is that people are underinsured, to your point. So I would say since the majority of Americans do have health insurance, it's actually underinsured who are being hit by medical debt. I think it depends on how you define impacted. If you don't have insurance, the chances are the medical debt you end up with is going to be a larger amount because you're going to be, responsible for the full cost of care. However, if you're underinsured, you're going to be responsible for that deductible, and you probably don't have it. Most Americans, or I think it's like half of Americans, don't have $500 in savings to deal with that, and yet many of them have insurance that requires at least $1,000 deductible, if not $5,000, $6,000 deductibles. The other thing I think is really important to point out is that, like so many other things in this country, it impacts communities of color disproportionately and more so. And that has to do with, systemic and historical racism. And a lot of it is that patients that are of color go to the doctor and aren't believed. They don't necessarily have the same outcomes when they have to negotiate for their pricing of their care, things like that. So it also disproportionately impacts people of color. And that's something I always like to flag.
Can you walk us through what exactly happens behind the scenes from the appointment that someone isn't paying for, the hospital stay that they can't pay for, to the debt collector knocking on their door?
So it depends on whether or not you're insured or underinsured. What happens is it usually takes a while, actually, for the hospital or other healthcare provider to figure out how this bill is going to be paid for. So they'll, send it to your insurance and find out either you don't have insurance, or if you're on Medicaid and maybe it lapsed. There could be a negotiation. There often is between the insurance company and the provider. That could take a year, 18 months. In that process, depending on the provider and their own policies, you may or may not, get a bill in the mail that says you owe this much. You may call and you might fight it. So it really depends. There's no standard approach to debt collection. And it really depends on your response too. What I like to tell people is, if you think that you're getting overcharged, don't take the first bill. Don't just get a bill and pay it. Do some investigating. I hate to say that because I think it's really unfair to put that kind of pressure on individuals, especially when they're dealing with a health crisis. You need one more thing on your plate. But I do think it's important that people recognize that there are a lot of loopholes and there's a lot of wiggle room, unfortunately, within the bill collection and what you actually owe, because we have this sort of patchwork of policies that end up making up our healthcare financing system. So, it really does take some time before you could end up knowing what you actually owe as an individual. And you have financial assistance policies at hospitals that you need to also sign up for, make sure that you understand them, and ask them to either discount what you owe based on your income or give you free care if you're really low income.
One of the procedures that I was shocked at, so I've gone through IVF, and you have to pay up front. You can't, so a lot of people put on their credit cards. The majority of people go into debt doing IVF. It's really crazy. But because these are privately owned practices, they can say, we're not going to do this procedure until you pay. So you pay up front. But I was shocked when I tried to negotiate, and I was successful at negotiating because I thought these prices were set in stone in there, and they're not. I think that it is more like going to a car dealer than going to a department store.
Right, which is why I go back to that issue of race, right? I mean, we know there's been so many specials on TV and things like that show you like the white person goes into a car dealership and they get a better deal than the black person. Yep. And the same thing happens in our healthcare system, which is why it's insane that we have a system where you're like, it's like sleazy.
Haggling.
You're like, yeah, exactly. Yeah. You're haggling for your healthcare. It's haggling for your healthcare. That should be like a course or something. It's insane.
You don't feel it with necessarily your physician because they're not in the loop. They don't know, what you're paying. It's really these back-end operations and the finance teams behind the scenes. And can you tell me, kind of how it transfers from that person to a collections agency?
Well, so it depends. I mean, honestly, I think at the end of the day, depending on the hospital, they get to decide whether or not they want to have their collections in-house, if they want to outsource it, and if they want to take the step of selling it. So, but to the patient, it's sort of opaque. Like they don't know whether or not the person knocking on the door and saying, you owe this much money is the actual hospital or is an outsourced entity that's saying they represent the hospital, or if it's actually been sold. And you can ask those questions, but who knows to ask those questions and how to verify whether or not that's true. I mean, there's also like fraud sometimes. I mean, there's, the situation is sort of a real mess in terms of collections and understanding that. Now, I will say that people should, again, going back to this, they should ask deeper questions about their bills. They should ask, do you own this debt? But really, it depends. Unfortunately, I hate to say it again, but my answers are, it depends.
We'll be right back after the break.
The COVID-19 pandemic showed us how a microscopic virus could upend our lives and how unprepared our society was for it. There's so much more out there that we need to understand, which is why I recommend subscribing to Crooked Media's America Dissected, hosted by former Detroit Health Commissioner Dr. Abdul El Sayed. Each week, Dr. El Sayed sits down with doctors, scientists, culture makers, and policy leaders to ask questions like, how could new genetic discoveries change our relationship with our own genes? How could addiction to social media change our brains? Or how even climate change could make the next major pandemic more likely? To hear discussions on these topics and more, check out America Dissected from Crooked Media. New episodes drop every Tuesday. Listen on Apple Podcasts, Spotify, or wherever you get your podcasts.
Here's a little song I wrote about how to grow delicious herbs. Just use Miracle Grow Potting Mix. It's not the longest song because that's all you need to know. Just plant your herbs in Miracle Grow Potting Mix and you're set. That's basically it. Then it's next stop, Grow Town. You'll grow healthier, stronger herbs versus unfed plants. Satisfaction guaranteed. Miracle Grow. All you need to know to grow.
beyond the financial implications of being in medical debt, what are the mental health components of living with the burden of owing money that you see?
Well, people don't go and get the care that they need. I think that's the number one thing that I would point out is that it's really fundamentally stopping people from going and getting the care that they need when they know that they have a medical debt and or if they're concerned about the ability to pay for medical care that they need. We also know that there's research showing that people are 3 times more likely to struggle with mental issues like anxiety and depression when they have debt. So it really is doing the opposite of what our healthcare system should be doing because we know that stress undermines people's physical well-being, right? There's a connection between your mental health and your physical health. And if you're stressed out, you're going to have high blood pressure, you're going to have hypertension. All these things lead to more expensive healthcare needs because you need more interventions. You need to get on medication to deal with your blood pressure, et cetera, et cetera. So that's what we know. We know that it has a real implication. People want to pay their bills and they feel like failures when they don't. And then that impacts their mental health.
Yeah, absolutely. What are some of the misconceptions about medical debt that you'd like to see addressed?
Well, I think people, first of all, have an old view of medical debt that it's always like $100,000. And it's, often the debts are smaller. They're $5,000 to $2,000. They're deductible amounts these days. I would say that that's one thing that's really important. So it's not, as you pointed out earlier, not just the uninsured, right? It's the underinsured. The idea that some people have that it's avoidable, right? That you could do something to avoid it. You can. I mean, you certainly can try to get insurance and all of that, but there's so many loopholes and there's so many things that aren't covered. You're not in the network and you don't have control over all of those things. You could go to a hospital that's in your network and a doctor that's serving that hospital and serves you isn't in your network and you could end up with a bill. So it's not the fault of the patient. And I think that that's the number one thing I would get people to understand is that people are victims of medical debt, regardless of doing everything right. We actually know that that's like a fact, that people end up with medical debt that have insurance, that did their research, and it's really unavoidable. So anyone could be a victim.
Yeah. Do you have any specific success stories or memorable experiences that you've had with individuals or families as they've overcome medical debt through your organization?
Absolutely. I mean, this is the favorite part, right? I mean, we get, it's like people are so overwhelmed and they're getting these bills in the mail and then boom, this one letter pops up that's like, hey, guess what? You don't know anything. You didn't do anything and you don't know anything. And that's the best part of my job. So a couple of stories that I like to tell is one about this man in Utah who was a veteran. He had nerve damage in his leg from his military service. He needed surgery. He was not able to have the VA. He had VA coverage, but he still ended up with lots and lots of medical debt as a result of needing this surgery. And the heartbreaking part is that then when his son, which he was so proud of, was ready to go to college, he couldn't co-sign the loan for his son's student medical debt. Like his son needed loans and he couldn't co-sign. And he felt like such a terrible father and a failure. Yeah.
Yeah. Well, I mean, so were you able to meet him and what was your interaction?
Yeah, there's actually the reason why we have his story. He actually did a video for us. And if you go to our website, you can hear him tell the story. And it's just, he's just like, wow, they took care of some of that medical debt. It's like, it's really great. And then a lot of the people that we help are, single moms tend to be obviously like so many things. They're burdened by medical debt. There was this one woman, Terry, that had her child prematurely. She was a high school math teacher, again, doing everything right. And she had insurance and she still ended up with medical debt and it followed her for years and years. And her story is actually captured in an NPR piece that we did. So I would also point people to look at that.
Okay.
Yeah.
So ripmedicaldebt.org.
Yes,
is where to
that's right.
kind of find these stories. So earlier you had mentioned that RIP medical debt is just a piece of the solution, but there's systemic issues that you'd like to see relieved. What is your role in that? And are you guys moving into more policy, advocacy, healthcare affordability conversations that are an important component to solving this problem?
Absolutely. I think we have a responsibility as a group that is cleaning up the mess of the broken system to say, hey, wait a minute. Why do I have to do this work? Like, we've got to fix this, right? Like, I mean, my biggest goal is to get ourselves out of business, that we fundamentally fix this problem, right? Like, I often say, like, I'm pretty employable, I think. I think I can find another job. Like, I'd be more than happy to do that. For us, what we want to do is make sure that we are lifting up the stories of these individuals, as you just helped me do, so that people understand the impact this is having on people, how widespread it is, and that we could do better. By doing that, I think we're fundamentally making sure that this issue is front and center, that it stays a priority, and that we are putting pressure on the system, politicians, to actually make some change and to make this a priority. And I'll say we have seen some success. We were invited to the White House last year. The White House put out, I know, it was great. And then the White House put out a statement recently about all the different things that they're thinking about medical debt and the ways in which they're making changes without having to go to Congress, because that's a whole other political fight, which is, unfortunately, this isn't unique to medical debt, that we're not moving the ball on a lot of policy changes, right? But they're doing what they can, and all they can do is keep putting that pressure on. So we do have a public policy department that we've just started that about a year and change ago, and we're looking at what the ways in which we can support greater change and more systemic change, and also lifting up the voices of those individuals. And so that's how we see our role in this.
Yeah, amazing. And you joined the organization as CEO right before the pandemic. Can you tell us a little bit about what you did before and what kind of brought you to this organization?
Sure. It was a crazy time. It was late January of 2020. I'm like, I'm going to take on this new role. And then I was like, I'm going to do it from my living room with my pre-K kid on my living room floor. Okay, I got this.
Oh my
gosh.
I did it. You got tricked.
Yeah, I did it though. I did it, and I'm grateful. Before coming to this role, I was the head of an association of nonprofits providing human services in New York City. So everything from the homeless shelters, after-school programs, childcare providers, mental health clinics, et cetera. And what I knew from that work was that we don't spend enough on social services. We spend a lot on healthcare. That is very different from other places across the other countries. And I think what that means is that that's why we don't have as good of outcomes, because we're not preventive, right? A lot of the things that healthcare addresses are what's called social determinants of health, right? So they are things like your environment, where you live, your home situation that impact your well-being and your health. And we don't spend nearly enough money on those programs. And that's what I was doing, was advocating on their behalf. And when I saw this opportunity at RIP, not only did I understand, because I had seen so many different interventions and nonprofits running, that this was different, but that it was needed because of the fact that this was really, the issue of medical debt is a clash between a broken healthcare system and a broken economic system, right? I mean, the fact that people don't have $1,000 is in and of itself a problem that has nothing to do with how we finance healthcare. So it's those two things together that make up this issue of medical debt. And it really aligned with the same populations that I was fundamentally serving through these nonprofits that I supported. So so that's why I came to this role and my background and the lens I do this work through. Yeah.
And we all face naysayers working in healthcare. You're in the nonprofit sector, so maybe a little less of the naysayers than for-profits are facing. But can you tell me about some of the biggest roadblocks that you currently face in the job?
Some of the biggest roadblocks, I guess, are getting, there's so many hospitals out there, and we have to get to all of them.
Yeah.
And get them convinced that this is a good thing to do, because we're a new thing, right? Like, they're like, what? Everyone's so innovative. Everyone loves to talk about innovation in a healthcare space. And there's always people knocking on, especially revenue cycle folks at hospitals, on their doors being like, we have another solution that's going to help you collect more money and it's patient focused and it's blah, 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 blah. And so getting them to say, like, no, seriously, we're different is hard.
Yeah.
It's really hard to break through, but I think we're making really good progress. We've gotten, some very large hospital systems attention, and they're working through us. And, we only started working directly with hospitals about 2 years ago, a little bit longer.
Okay.
And so, we don't have a lot of time under our belt working directly with hospitals yet. They are, when they do pay attention, which they have been doing, they come to the table. And so that, I think, is huge. Yeah.
Well, it makes sense, right? Like they actually want their patients to not have the burden of the debt so that they can come back and have the preventive services that they need to hopefully prevent more, catastrophic healthcare issues.
Exactly.
What's next for you guys? You talked a little bit about some of the policy work and going to the White House. Like, how do you see the organization evolving?
So we're building capacity. Like, we really want to get our hands on a lot more medical debt. One of the things that's been happening, which is pretty incredible, and I'm sort of pinching myself all the time, is that government is knocking on our door left and right. So we've really been leaning into those relationships. For example, Cook County was the first local government to come to us. That's in the Chicago area. They gave us ARPA funds, the American Rescue Plan dollars. They allocated $12 million for us to relieve $1 billion of debt in Cook County. And we've already relieved $80 million of debt there. And we've got many more hospitals on the horizon. So we'll be doing more work there. The city of Toledo came right behind them and said, wait a minute, we heard about Cook County. Can we do this too? So we've got work going on there. We signed a contract recently with the city of New Orleans. We've got at least 30 other city, state, and county governments that have asked us to engage, and many of them have already passed budgets that include funding for RIP medical debts work. So that, I think, is what we're really leaning into at this moment.
Amazing. And how can listeners support your mission?
They can go to ripmedicaldebt.org and they can start campaigns. They can make a donation. And you can also, if you're associated with a healthcare provider, get them to call us and to talk to us about selling us their debt. I mean, none of this works if we don't have access to the debt.
Yes. Yeah. We have a lot of providers that listen. So I'm sure their ears are burning right now and they're excited to connect. Allison, thank you so much for being here. And thank you for all that you do.
Thank you so much for the opportunity and for lifting up this important issue.
Thanks for listening to this episode of The Heart of Healthcare. If you like the show, be sure to subscribe, leave a review on Apple Podcasts, follow us on social, and tell all your friends to listen. The Heart of Healthcare is a product of Offscript Health. We are a healthcare engagement company built for patients and caregivers by patients and caregivers. Our executive producers are Matthew Zachary and Andrew McDowell. Our host is Hallie Tecco. For advertising and media inquiries, email media@offscript.com. That's media@offscript.com. For more information, visit offscript.com.